Hello, Somerset County, and welcome to this edition of the Scoop Podcast. My name is Chris Edwards. I'm the President and CEO of the Somerset County Business Partnership. Before we get to today's program, I want to give a quick shout out to our sponsors for this Scoop Podcast, what we're calling Season 2 of the Scoop. We have Unity Bank, Robert Wood Johnson University Hospital Somerset, and Techie Geek, who are the builders of the podcast studio. I want to give them a shout out. You'll be hearing from all three of them throughout Season 2 of the Scoop Podcast. Today on the Scoop, I think we have a very interesting guest. And I'm not just saying that because you're sitting right in front of me, Dr. Green, but I think your story of going from a large healthcare institution to starting your own practice is a really interesting story. And I love that tie-in as a small business owner. So we're joined today by Dr. Camille Green. She's the physician, founder, CEO, and Chief Everything Officer of Evergreen Internal Medicine. Welcome to the Scoop Podcast.
Thank you so much, Chris. I'm glad to be here today.
Yeah, no, thank you so much. I know your schedule, I imagine everything that you're doing, and then also working with patients really probably limit your schedule, but I appreciate you taking some time for the Scoop. So I want to give you a chance to really tell your story. Obviously, we'll talk more about Evergreen and kind of the vision you see there, but tell us how your career started and where you were previously, and then we'll go from there.
Sure. So I guess we could start why I wanted to be a doctor.
Yes,
yeah,
no, it's great.
So when I was growing up, I had three brothers. Yes, I was the only girl. Okay, no, I'm joking. So, and my youngest brother, he got really sick when we were younger, and he had this thing called Hirschsprung's disease, and he had to get a surgery when he was a child. I grew up in Danbury, Connecticut. Now I'm a Jersey girl, though. Don't worry, guys. So we had to go to the hospital, and we were at Danbury Hospital, the local hospital, and then the guy was like, "What's going on with him? He needs to go see my teacher." So we ended up going to Yale, New Haven. And the doctor that did the surgery for him was the late Dr. Seashore. And I remember we were all there so scared. We wanted my brother to live. And Dr. Seashore came in with all these people behind him, which now I know are residents and everything. Everybody had on the white coats and everything. Right. They came into the room, and my little brother Mark was sitting there in the he was like in the hospital bed, and he came and he was like, "Hello," and then he and Mark, they shook hands, and I remember just seeing that moment and just like feeling, he's going to take care of my brother. Wow. And my brother, it was a successful surgery, and he's now absolutely awesome and doing well.
How old are you during that experience?
So my brother was probably around 4, so I was somewhere between 6 to 8 when this all happened.
So that really had an imprint on you.
Yes, and I was just like, a doctor changed our lives so much.
Right.
I have my brother. I want to do something like that to help someone in the future.
Wow. And where'd you go to school?
Yeah, so I ended up going to Yale.
Oh, there you go. Oh, perfect. Full circle.
Yale undergrad, and it was so crazy when I was there, and I was pre-med,
Yep.
And one of my friends that was at the medical school, she brought me there, and I got to meet him.
Wow.
And I got to tell him, Dr. Seashore, I am here, and I became a doctor because of you, and we got to talk and everything, and that was a full circle moment.
Yeah.
So I knew I wanted to do medicine. I knew I wanted to help people, and I wanted to, I guess it's kind of interesting. I did think about the PhD route because of one of my other teachers that had. Oh, it's a long story. We won't do that because that'll be too long. But
that'll be part 2 of the podcast.
Yeah. But I wanted to fight cancer as well. That became something that became an interest to me too. And so at the end of the day, I was like, I like people, not just being in the lab, and that's why I went that route.
Right.
And now, I went to Yale undergrad, then I did Rutgers Robert Wood Johnson Medical School, and now, I've been practicing for over 10 years.
Yeah. So that led was 100 and Health your first stop. Talk a little bit about your experience there, and then maybe where you started to think about, okay, hey, I want to kind of branch off and start my own thing.
Absolutely. So it was not my first stop. My first stop was actually Cooper University Healthcare. Yep. It was in South Jersey, the level 1 trauma center there. And I was also an assistant professor of medicine, teaching young minds and young medical students and, residents. So I was there for, like a long time. And then I came to Hunterdon. So, and it's kind of an interesting story, but how I got there. But anyway, so then I came to Hunterdon. I was there for many years. They appointed me to be chief of internal medicine there. I love what I do, continuing to do, preventative care. So I think that when someone's in medicine and they're trying to decide, where do I want to be on this spectrum of fighting disease? It's like we have the people that are in the, like, I call it the spectrum, right? Like that are towards the advanced, the ending of diseases for people and fighting in that way. But I knew that I wanted to be in the preventative side. And I'd started off actually in radiation oncology, and I was literally in that residency. And I remember the first time that I was like, this is not what I want to do.
Right.
And I want to fight from the other side, upstream of this process. Right. And so I went into internal medicine and was at Hunterdon for, about 5 years. And then I was like, I want to do something different, because what I thought about is I want to be able to have more time with my patients. For me, the why is it was like, it's like kind of like a little bit of an assembly line when people come to see the doctor. Yes, yep. And I was just like, that's not where real healing happens.
Right.
Sometimes healing happens at like the 20th minute. But if you had 15 minutes, you didn't get there because you didn't get to talk about certain things. Yeah. And so I wanted more time with my patients and also more focus on prevention, not just taking care of the disease, but how can we prevent hypertension, high blood pressure? How can we prevent type 2 diabetes? How can we use nutrition, exercise, and all the things we know in prevention to fight even getting the disease? And even when people get there, taking care of it. Sometimes wellness is not covered.
Right.
And that's why I wanted to go into this area of medicine.
Welcome. This is Kevin from Printing and Promos Plus. Need print solutions that deliver? From business cards to banners, custom apparel, and promotional products. We have it all to make your business stand out. Contact Kevin at printingandpromosplus.com.
Do you think, and this is just a theory I have, I have 2 young boys, and when they were born, they had what I always called like a very old school pediatrician, right?
Yes.
Someone that, had seen parents and their parents and that type of thing in town. And
yes.
Then he retired and it got bought out by a bigger practice.
Yeah.
And that's where there was nothing wrong with the care that we received, but to your point, it very much felt like an assembly line.
Yes.
And I'm wondering, as a lot of the bigger players in the healthcare industry kind of gobble up a lot of the smaller practices, is that what you felt and maybe seeing here from your patients is like, hey, like you're going in and it's like a deli. You're the next number, right?
That's right. Yeah. Exactly. And that's exactly why I wanted to form Evergreen Internal Medicine, because I believe that medicine is personal and it should be. And I believe that patient-physician relationship is actually randomly part of healing, and time within that relationship and talking is where a lot of medicine I have found things that others have not found.
Right.
So like, I think about this case when I was like in radiation oncology and I had 2 medical students with me. I was the resident or the fellow, whatever they call it. And we were there, and the patient had come in because he had liver cancer, which is called hepatocellular cancer. And so he's there with us. I'm looking at him. He's jaundiced. He's talking about his knee pain, his arthritis, and then talking about, and I was like, do you have diabetes as well? And we're going through this whole thing. And then I'm like, do you have hemochromatosis? And the patient's like, yes, I do. And so the medical students are like, oh my gosh, right? And so what that is that's a disease where iron is depositing inside of the person rather than being taken out of their system. Yeah. It's depositing in the liver. It's depositing between the joints. It deposits in the pancreas, which makes them prone to diabetes. They get arthritis from the iron that's there. And they're more prone to liver cancer because of the inflammation that's happening because the iron is depositing in the liver.
Wow.
So I put that all together as I was there, like listening to the patient. And when I came out, and the medical students are like, oh my gosh, I'm going into radiation oncology. They're the smartest people. And they actually did, both of them. One's at MSK and the other thing is at MD Anderson.
Yeah, it was a powerful moment
for them. But I came out, I presented that to the radiation oncology, felt like person. And they were just like overwhelmed with the pathophysiology and the whole thing that I was explaining. And then they were like, we're just going to shoot the cancer with the radiation rays. We're just, and I was just like, it was that moment. That was the first patient I presented that I knew I was in the wrong field. Because what excited me was that part, not this part. Yeah. And so I think that when I think about, though, that I saw so many cancers. I've seen cancer, every type of cancer I've seen. Mm-hmm. And I've seen it at the early stages and the late stages. And so I know how important early is.
Right.
And so that's why I wanted to come. And then before early, how can we prevent, right? So that's why I think that wellness medicine, doctors need to be in that space.
Right. Yeah.
And that's why I joined with MDVIP, which means Medical Doctors Value and Prevention. That's the company that I'm also working with for my company.
Right.
It is mine. I'm a small business owner. Woo,
You're in
which
the
is
right
its
place.
own thing, you know? But it's like, but I know what I want to offer.
Right.
And I want that personalized medicine with prevention focus. We still take insurance
Right.
as well, but it's membership-based medicine. So I have a smaller panel of patients so I can have that time and that focus to be able to be with them. But we still take insurance and Medicare for their regular covered services. But now they get this annual 90-minute like physical where we're looking at the things that we know about longevity medicine
Right.
and we're working backwards from that. So I'll give an example. We know lower extremity strength is tied to longevity of life. When people are older and they're doing this whole little wobble thing, it's because they've lost some of that strength. And from
Right.
35, we start losing muscle mass.
Right.
So it's like, we know we need to fix that. We know we need to plug that. We know we need to work on that to help somebody so that when they're older, they're doing well and they're still having fun and they're still able to play with their grandkids and stuff. And so what we know is that we need to work from that.
Right.
And there's a whole bunch of other things. There's a lot of things,
No,
but that's just an example of knowing what we know and then working on a personalized plan to make sure we get people there.
Yeah, no, I think that, I mean, look, it makes a ton of sense. I think it's certainly a hole in the market from what I see. Because even you were mentioning the liver cancer patient, like a lot of times through, the experiences I've had with family members and stuff, there's everything you just said in there sounds like it's like 10 different appointments, right? Over
Yes.
2 years.
Yes.
And at that point,
Yes.
when it comes to cancer, everything is a time
That's right.
game, right?
Exactly.
And that's what bogs everything down.
Absolutely.
And it's not that anyone did anything wrong.
That's
it's how the
right.
system's built.
That is correct.
Yeah.
It's built so that things can, I hate to say it this way, but in some ways things are kind of missed because we don't have enough time. It's really
Right.
interesting, when someone's doing someone's lawn and they're like, and they're actually like, they have the nice little gear and they're going over it. Dwell time over that grass is what
Right.
actually cuts it correctly.
Right.
So, but somehow with operational efficiency, the time with the patient is not part of the
Right.
actual value,
Right.
which is deep.
Yep. No, I agree. And
Yeah.
So that led to the kind of the birth of Evergreen in internal medicine.
Yeah.
What are, maybe as a kind of to tie this into the business community,
Yes.
as a small business owner, what are some of the things that have been surprised you from a positive, and maybe some things that you're like, oh my God, I don't know what I got myself into?
Oh my goodness. Wow. So okay, I'll say that as an employed physician, there's a lot of things that you don't have to think about
Right.
because it's built into the system. But now I am building that system. But I will say that one of the things I started to feel is that I was like, I see things that I would love to do differently, right? And so it's like, I want to build so that there's more time, and that's already built into the system. I want to build that I have, instead of 2,000 patients, or 5,000. When I left Cooper, I had 5,000 patients attributed to me.
Unbelievable.
I'm going to have 200 to 300 so I
Right.
can really focus. And so, I think that just, structuring it so that the patient is the center and the patient-physician relationship is in the spreadsheet. I guess I don't even know what to say.
Right.
Is what I think is missing in medicine. And I always believe this about our healthcare system. We have all the right parts to make a good sauce.
Right.
But the wrong person has the spoon.
Right.
And so so now I'm going to have
I
the
like
spoon.
that analogy. Yeah.
I'm going to take the spoon. I'm someone that went in to do no harm. I took an oath. I'm here to take care and to heal.
Right.
And so we should have the spoon.
Yeah. Well, if the patients need a new spoon, how could they, maybe talk a little bit just about the membership model,
Yes.
because I think that's a unique concept. And
Yeah.
I mean, most of the people who are listening are members of the chamber, so they understand the membership model.
That's right. That's right.
Can you talk a little bit about that?
Sure.
And then, how can people get in touch with you if they want to learn more?
Absolutely. So the membership model for my practice, and I'll say is with MDVIP, they're helping me with the structure of things.
Right.
But so what that is that people will pay an annual fee, and that allows them to get that 90-minute, full, thorough looking at longevity medicine and working backwards from it. And then you come in after we've looked at everything. And there's a lot. It's not just the physical part, because you get a full body analysis. We look at pulmonary function. We do vision. We do hearing. Hearing's tied to protecting against dementia.
Right.
45 and up, everybody should be getting a hearing test.
Right.
And we know that, but it's not done in primary care. So I like to say we live in that place where we're ahead of the curve, so to speak. And then the lab work, we go beyond the lipid panel. We look at lipoprotein A and lipoprotein B1 and high sensitivity CRP, which is looking at the amount of inflammation around somebody's heart. We've partnered with the Cleveland Clinic to look at the most up-to-date things. And that's what's cool about once you join my practice, we will always be looking at what's most up-to-date and then working from there to incorporate it.
Right.
So like the testing that looks at the 31 types of cancers, that's part of my practice. So it's like we're on the cutting edge in prevention. So you come in, you join, you pay the membership fee. And then from there, we also use your insurance for your regular covered medical things. So like your regular physical, you still get that.
Right.
You still get all the, any screenings that you need, that all still going to go through your insurance. So it's kind of like, I like to call it the best of both worlds, because it's a hybrid.
Right.
It's a hybrid model where insurance and wellness are married together.
No, I think that's a perfect way. And I feel like you're just, you're talking to someone like me who's, I'm in my late 30s and maybe neglected, those things. And then you hit a certain moment, where you're like, oh God, I gotta start taking care of myself and doing these appointments and thing and that type of thing. So, I certainly want to put a nice bow on this. How can people get in touch with you? First, where are you physically located? And how can people get in touch with you? Yeah.
So absolutely. So I am in Branchburg Commons. So I'm in Somerset County. So what I love about my location is that I still get to serve the people from Hunterdon and Flemington.
Right.
But now also am serving Somerset County. So I can get people in Bedminster and Basking Ridge and Bridgewater, Hillsborough, Somerville, Branchburg, all of these areas are now opened as well, that they could come to see me.
Oh, no, it's beautiful facility right off the highway.
Right off the highway. And we're in Suite 408 right now while they're finishing up the space for 802.
Okay.
So
we'll be doing the ribbon cutting for that.
That's right.
So,
exactly.
yes,
you guys are invited. And then if they are interested in learning more, then you can call 908-948-0018. That's 908-948-0018. And to learn more about my practice and to sign up. Or alternatively, go online to mdvip.com/Camille Green MD.
Awesome. Well, Dr. Green, I think your passion for what you do kind of permeates through this conversation. I'm sure it will through the podcast.
Thank you.
I want to thank you so much for coming in and for Somerset County until we upload again. All right, perfect.
All right.
I was looking at the time over Carly's shoulder.
Yeah.
It was 15 minutes on the dot.
Okay, great.